Good afternoon. Welcome to the City of Toronto COVID-19 media briefing for Wednesday, June the 24th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, Brad, thank you and good afternoon. It's an important day in our city. It's one that is worth celebrating and one to make us think about how we can keep moving forward. And I guess the first reason I want to point out that it's worth celebrating today is because it's grad day. We've proclaimed that in the City of Toronto because there are so many graduates, especially those, of course, graduating from high school, who missed out on a rite of passage that many of us had the good fortune to have. They are graduating from high school, or for that matter, from elementary school, moving on to high school. And these are big milestone events in the life of a lot of these young people. So we can't gather together for graduations as we're accustomed to doing, but we are celebrating you, I speak to the graduates, and your accomplishments as an entire city. It's been a tough year for everybody, but students have had a tough year as well, being in and out of school and having to learn and do all the things that's expected of them, especially in graduation years, without the ability to be in the classroom with teachers. And on top of that, there's been what I'll call the psychological effects of missing teachers and missing your friends and the enjoyable parts of going to school as opposed to the parts that may not have struck you as being so enjoyable. So along with an official proclamation of today as Grad Day, we've lit the Toronto sign in gold to commemorate your gold medal and gold level performance and to say congratulations on a job well done. And I think you can just know that your city and your mayor and all the people here stand behind you as you move on to what I'm sure will be exciting next chapters in your lives. So it's also a day worth marking and worth celebrating because Toronto and Peel moved into the beginnings of stage 2 of the reopening. So you can visit a patio and you can go to the mall and you can get a haircut and get your nails done and you could even get a tattoo if that's what you've been waiting for. You can bring your kids to play at a splash pad and soon to an outdoor pool. We are at this point thanks to the efforts and the sacrifice of all of our frontline workers and the sacrifices and the discipline of individual Torontonians who have been following the advice of our public health officials. We're reopening because the vast majority of Toronto residents and businesses did the right thing, difficult as many times that might have been. And now it is important that we keep doing the right thing. Keep following the public health advice so that we can continue to stop the spread of the COVID-19 virus and so that we can move to the next stages of reopening as soon as possible. There is risk in any reopening that the virus could flare up again. We've seen that in other jurisdictions in North America, and we do not want that to happen here in the City of Toronto or anywhere in this region or in this province or in this country for that matter. So I would urge people to continue to take precautions that have been given to us, advice that's been given to us by our Medical Officer of Health, including wearing a face covering whenever you can't keep your distance from others. Personal responsibility really has been the key to defeating this virus up to this point, because it's not completely defeated yet by any means. And it will be the key to obliterating it and to completing the job of defeating the virus and making sure that our city and the economy and all the jobs that go with that and all the happiness and prosperity and support that those jobs bring can come back strong. Reopening restaurants for patio service will stimulate our economy, will provide jobs, will restore jobs, and with the right public health measures in place, will safely alleviate some of the cabin fever that people have been feeling for some time now. But to really ensure the viability of many of those businesses that we treasure, these local restaurants and local watering holes, and which employ so many people, we have to keep our health numbers going in the right direction. We have to do that so that we can make sure it is safe enough to open up even more, because the viability of those businesses depend on doing much more to open up than we have presently done. But I do want to be clear that the more than 1,400 restaurants with existing licensed patios, sidewalk cafes, or parklet permits can open immediately with no need to pay a 2020 permit fee. For restaurants and bars without existing outdoor space, through our CafeTO program, city staff are working closely with the operators, the applicants, to find options for innovative cafe configurations within the right-of-way, meaning on some of the public spaces, including curb lanes and so on, to allow for extra space. The CafeTO program has already received more than 250 completed applications, and the staff are working at wartime speed, as I call it, fast speed, to get through all of those as we, at the same time, take it forward for final approval at City Council on Monday. Ahead of the Council vote, City staff, as I said, are working closely with qualifying local restaurant and bar operators to establish options for cafe configurations, while also temporarily pausing certain bylaw elements so that we can move very quickly on this and make sure that these permitted cafes meet accessibility and physical distancing requirements and can get into business as soon as possible. I encourage all local restaurants and bars currently without outdoor space to explore the CafeTO program and, if applicable, to apply and register for it as soon as possible to better understand the program requirements and to start planning so that you can get that extra revenue producing ability, that extra space in place as soon as possible. Restaurant and bar operators interested in CafeTO can register for an online information session which is happening next Tuesday. Staff will answer questions, will provide updates on permitting and licensing, enforcement, public health guidance, and you can visit toronto.ca/CafeTO to get more information on all of this, including the session next Tuesday. City staff have also been working closely with the Toronto Association of Business Improvement Areas, called TABIA, with the restaurant industry and with other key stakeholders to navigate all possible considerations and anticipate issues, and frankly, to make this as easy as possible so that we can get this extra space available for you to enjoy yourselves, but for them to take much needed revenue in to help to cause their businesses to survive. So my hope is to have as many of these new, safe outdoor dining areas open across our city as many as possible by next Wednesday, which is the first day they can, under this program, legally open their chairs and their spaces for business. Now, reopening work by city staff is well underway today in the city itself. Parks, Forestry and Recreation staff started turning on our 140 splash pads at 4 o'clock this morning. And so some of them will be ready to go now as we speak. The plan is to have 100% of the splash pads operational within 4 days, which is ahead of the original 7-day schedule. I'm looking forward to visiting one of those splash pads this afternoon to thank families for their patience and to say thank you to our city staff who are doing a great job of getting these open ahead of schedule. And I want to thank city staff in a number of these areas as we reopen recreational and other kinds of facilities for the work that they have done to plan so that they can get it done quickly and have these facilities available to the public. I'm also very pleased to share with you today the fact that CafeTO and its cycling network are also expanding again. We're ready to deliver not one, but 2 major downtown cycling network connections. It's been less than a month since City Council overwhelmingly approved the largest expansion of Toronto's on-street bike network ever in any one year. And I'm proud of the work that's getting done at wartime speed to help our city to actually get these into place and to achieve the benefits, which are many in number in terms of mobility, in terms of transportation options, in terms of the environment, and many other different things. Last week, I announced that a new bikeway was ready to go and be installed on University Avenue, Queen's Park Crescent, from Adelaide Street west to up north to Bloor Street. That 2.3-kilometre safe, separated route was fully installed a few days ago. It is now in place and people are using it. And the feedback from people already biking on University Avenue in the safe, separated bike lanes has been incredibly positive. By the end of this week, another 1.5 kilometres of safe, separated bike lanes will be in place along Bloor Street between Avenue Road and Sherbourne Street. And all of this comes as our city enters stage 2 of the province's restart plans, and right on time to support our frontline healthcare workers and other people who just need to get to work. They need to get to work with options for transportation. They need to get to work safely with appropriate physical distancing, and that is especially true along the spine of the transit system, which people still might be anxious about using, though we're trying to reduce those levels of anxiety with all the different measures we've put in place, including mandatory face coverings. While today marks an important milestone, there's a tremendous amount of other work happening right now in terms of this CafeTO cycling expansion program. Design and installation are well underway on other routes, including Brimley Road between Lawrence Avenue and Kingston Road in Scarborough, Huntingwood Drive between Victoria Park Avenue and Brimley Road, Wilmington Avenue, Faywood Boulevard between Finch Avenue and Shepherd Avenue in North York, and Bayview Avenue between River Street and Rosedale Valley Road in the downtown area. The new bike lanes on Brimley Road will be installed starting next week, which will introduce 4 kilometres of safe north-south connections for people on bikes in Scarborough. More than 10 kilometres of roads will also be used for active TO again this weekend to help make room for thousands of people, as we've seen from the measurement, thousands of people to get outside and to get active while respecting the need for physical distancing. Since the outset of COVID-19, the City has received input from residents and businesses, and this feedback has helped with the City's response to this crisis, which I believe has been largely effective. Now, as we look to the future and how we recover and rebuild, we want to hear from residents and businesses about the programs and services that are important to them during this process. We recognize that residents and businesses and neighbourhoods will play a significant role in successfully restoring communities and social and economic infrastructure and continuing to support people that we've been able to support so well during the course of the pandemic, with the full partnership of the private sector, the non-profit sector, and individual citizens. On May 29th, our Toronto Office of Recovery and Rebuild launched an online survey to invite active input from residents and businesses and nonprofit organizations and individual communities on how the City of Toronto can recover and rebuild strongly in order to make sure that we can emerge stronger from this pandemic. As of this morning, more than 7,690 individuals and groups have gone online to fill out their survey to tell us about their priorities and what they've seen or done or what we can learn from the pandemic and how they think we can make the city better. Now we're entering the survey's final week, and we want to hear from you before the survey closes for public participation on June the 30th. And so if you haven't done so, please go to toronto.ca/recovery-rebuild to share your ideas. We'd love to get that number up into many more thousands of people so that we have a really valid sampling of opinion. New bike lanes, resumed ferry service we announced today to the island, to our beloved islands, open patios, new patios, hair and nail appointments, splash pads, pools. All these are signs that we are moving forward. When we came forward about 12 weeks ago and said it would be probably a largely 12-week shutdown plan, we were advocating, after horrifying projections that we had received about people being taken ill and thousands of people dying, upwards of 4,000 people at minimum dying right here in our very own city. Those measures that we put in place as of that time in cooperation with the Province of Ontario and the Government of Canada took themselves a horrifying toll on jobs, on mental health, on people's finances. But they did save lives and they did preserve health. And so now we're moving forward. You might even say at last we're moving forward. And if we keep demonstrating good health practices, following what are pretty basic, simple guidelines that we've been given by our Chief Medical Officer of Health, and if we demonstrate common sense and consideration for others and personal responsibility, I am convinced, absolutely convinced, from everything that I know and everything that I'm understanding from our discussions, that the next stage of opening up on our journey to the next normal cannot be too far away. But it's up to us, as it has been all the way through, and I thank you for your patience and understanding and cooperation to date. And on that note, I'll introduce our Medical Officer of Health to provide her report for today, Dr. Davila.
Thank you, Mayor Tory, and good afternoon. Today, there are 73 new COVID-19 infections in Toronto, and 12,061 people have recovered, an increase of 101 since yesterday. I'm encouraged by the steady decrease in our cases that are a result of your actions. As always, for more information, I recommend visiting our website so that you can find out more about the status of COVID-19 cases in our city. Today is a significant day for us. Today, we join many communities around the province in Stage 2 of reopening. We are making good progress in reducing the spread of COVID-19 in our city. And this is the result of your continued hard work and your commitment to our public health measures. Together, we are protecting our friends, our families, and our loved ones, and making sure that our healthcare system is available for those who need it. Today also marks 5 months since our first media briefing on COVID-19. We continue to learn about this virus and how to prevent its spread, and we still need your commitment to ensure that we continue to move forward. Today, our dashboard shows that our status remains yellow. We are seeing lower hospitalizations and ICU admissions due to COVID-19 as a result of your hard work to maintain physical distancing and your diligent hand washing. Your shared commitment and actions have allowed us to reopen and will help keep us moving forward. What is clear today is that our success so far and our ability to get back to enjoying our city relies on our continued commitment in the days and weeks ahead. So while today marks an important day for us, we need to continue to be careful so we can keep moving forward. As I have shared before, the reality is that COVID-19 remains in our community, and we need to learn how to live with it safely while a vaccine and treatments are developed. We know that COVID-19 has an incubation period of up to 2 weeks, which means that any new cases that result from easing of our public health measures will start to appear in the next week or two. We also know from the experiences of other jurisdictions that we can expect to see an increase in cases as more people are connecting, mixing, and moving around in our city. And until a vaccine or treatment is available, we must continue to be careful and to take care of each other. We need to keep assessing our local circumstances each week. Otherwise, we run the very real risk of losing our progress. At this time, we are safely and carefully moving forward into stage 2. As we live with COVID-19, this means that we must remember that being in close contact with others, especially in indoor settings, is a significant risk for virus spread. We must keep 6 feet distance from anyone outside of our social circle, and we should wear cloth masks to protect each other when we are in public spaces. Remember, my mask protects you, and your mask protects me. Lastly, I wanted to let you know that next week, our Board of Health will meet virtually once again. One of the items that will be discussed will be our current COVID-19 response and recovery efforts. As part of my presentation, I will be recommending that City Council request the City Manager to engage the Public Health Agency of Canada, Public Health Ontario, and the Ontario Ministry of Health to support my team's work to establish a volunteer isolation and quarantine center system, as well as other methods to support effective isolation for people who become infected with COVID-19. This report and the complete meeting agenda are available online. In closing, I ask that we not undo the progress that we have made so far and the many personal sacrifices that we have made over these past few months. Like others around the world, we are finding the balance between keeping COVID-19 in check and living our lives. I'm confident that we can keep the positive momentum going. Thank you again to everyone for working so hard to get us to this point. We have come a long way together. And it is for this reason I ask you again to please consider others and please keep following our public health advice. Please continue to keep your distance from others outside of your social circle. Keep washing your hands. Keep wearing your cloth mask so we can protect each other from our germs. And please, continue to take care of each other. I'll now turn it over to Chief Pegg for his remarks.
Thank you, Dr. Davila, and good afternoon. Nearly 6 months ago, I began working with Dr. Davila as we began to learn of the global emergence of then coronavirus. Under Dr. Davila's leadership, the evaluation and proactive planning for what would soon become COVID-19 was underway, long before the first case was reported in Canada, let alone in Toronto. In March, I was asked by City Manager Chris Murray and Mayor Tory if I would lead the City of Toronto's response to COVID-19. In short order, I assumed the COVID-19 Incident Commander role on a full-time basis, beginning what has been a demanding yet rewarding journey. Together, we built and operated the largest incident management system in our city's history. I will forever be proud of the way in which Toronto has responded to the COVID-19 pandemic. As we continue into stage 2 of our restart plan, I'm even more proud of our city and our team as I think back over the past number of months. Throughout our response to COVID-19, we have never wavered from our overarching goal of saving lives and preventing our healthcare system from being overwhelmed. We have all listened intently as Dr. Davila updates us on rates of infection, recovery rates, and unfortunately, on the residents of our city who succumbed to the COVID-19 virus. On behalf of our entire team, I extend my sincere condolences to each and every person who lost family, friends, and loved ones to this terrible virus. Throughout my career, I've maintained the same overarching priority at each and every incident that I've ever responded to, both as a first responder and more recently as your fire chief, and that is to do all that we can to prevent both injuries and the loss of life. There has not been a single day where our teams haven't given their very best to save lives and prevent the spread of COVID-19 in our city. We've had to make difficult and often unpopular decisions, but in doing so, thousands of lives have been saved. And today, we are able to proceed with the next stage of restart as a direct result of the sacrifices made by each and every resident and business owner in our city. You have sacrificed much and have saved both lives and livelihoods in the process. Our teams have been primarily focused on service restart planning and implementation for the past number of weeks now. Our citywide service restart and readiness team is now hard at work, under the leadership of Deputy City Manager Tracy Cook, and in collaboration with members of the Office of Recovery and Rebuild, led by Saad Rafi. Now that we are transitioning from COVID-19 response to city restart and recovery, I will now transition back into my role as fire chief, as well as the general manager of emergency management. As I transition back into fire services, I will continue to work closely with our Office of Emergency Management team and will continue to directly support our ongoing city restart efforts. As an emergency management team, our priority will be to ensure that we are ready to respond to the next emergency, whenever that should happen. We are also hard at work ensuring that plans are in place in the event that we experience a future wave of COVID-19 in Toronto. We cannot let up yet, as COVID-19 continues to circulate in the city. This is not over yet, and we must all remain vigilant. While our EOC continues to operate at level 3 and will continue to do so until the emergency declaration has ended, we are scaling back our incident management system now that the COVID-19 situation continues to stabilize. Of course, key functions, including the PPE task force and the business continuity task force, to name but two, will continue in support of our restart and recovery teams. Leading the response to COVID-19 has, without any doubt, been the most challenging emergency incident that I've ever managed. it has also been the most demanding. I will forever be thankful for my wife, Catherine, my family, and my friends who have supported what has been the longest sustained response and deployment of my career. If I were to take time to name and thank every member of our team who has given so much in response to COVID-19, we would literally be here all afternoon. I'm blessed to work alongside some simply amazing, dedicated, and incredible people each and every day, from every division and agency in our city, who have gone far beyond the call of duty every day. So, suffice it to say that I am deeply proud and extremely thankful for each and every member of our team across the entire City of Toronto who has given their all. The results that have been achieved have come at their hands, and to each and every member of our team, I say thank you. But I would be remiss if I did not acknowledge Mayor Tory, City Council, and the City's corporate leadership team, and to thank each of them for the unwavering trust and confidence that has been bestowed upon me in this role. I'm truly honored to have been selected to lead our response to COVID-19, and so very much appreciate your support, trust, and confidence throughout. To Dr. Davila, thank you for simply being awesome. You've been a calm and steady voice in a world of uncertainty, fear, and anxiety for so many. We lived away from our families for more than 2 months straight, and together we reviewed, planned, calculated, and responded. You are a caring, compassionate, and consummate professional, and we are more than fortunate to have you here leading us through this pandemic. Thank you. Olivia Labonte, who is right there, as she has been throughout COVID-19, is here with me today and has been beside me from day one in this role. Olivia defines what it means to be a genuine professional civil servant who never quits. Her energy, drive, and passion for delivering public service never ceases to amaze me. Thank you. And finally, to each and every resident and business owner who has given so much as you have accepted our advice and direction and pulled together to beat COVID-19. Thank you too. We've come a long way, but we still have a long way to go. I encourage everyone to continue to follow the advice of Toronto Public Health in order to do all we can to prevent a resurgence of COVID-19 in our city. In closing, and as always, because it just wouldn't be right if I didn't end my remarks this way, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. One final big thank you to Brad and our communications and technology teams who you can't really see here, who've worked every day to ensure that we are able to connect with our residents and our media colleagues. Thank you. Each of you are truly outstanding. Thank you.
Mr. Mayor?
Brad, if I may, we will have a suitable opportunity to say thank you to the Chief and others at another time, but you will not necessarily be seeing as much of him. And I realize that may leave a scant few of you who tune in to see Dr. Davila and myself. We're a little worried about that. But I just want you to know that the professionalism, the integrity, the organization, the collegiality that he has demonstrated makes me very proud to have somebody like him available to us to take on this kind of responsibility and, of course, to return to the very important responsibilities he had before the pandemic as Fire Chief and Director of Emergency Management. And so I want to thank him, notwithstanding the fact that those difficult decisions, many of them bearing bad news, he helped to make and then gave them to me to announce, and I will remember that. But having said that, he's an outstanding public servant himself, and we'll have occasion to pay tribute to him and to Dr. Davila and others at a later time when we get to the point where we can really say this is behind us. But thank you very much, Chief Pegg.
Thank you.
Thank you, Chief.
Thank you, Mr. Mayor, and thank you, Chief, and thank you for your unflappable leadership throughout. We'll go to questions now. Staff on the line to answer any detailed questions reporters may have include Mary Ann Bedard from Shelter Support and Housing, Janie Romoff from Parks, Forestry and Recreation, and Paul Raftis from Senior Services and Long-Term Care. First question is to Matt Bingley from Global News. Matt, go ahead, please.
Hi, good afternoon. Mayor Tory, I was speaking to a business owner this afternoon who had applied for CafeTO, but because of his location, he's on a corner in Roncesvalles, and he was told that he wasn't going to qualify for that and thinks that the program needs to be a little bit more flexible. Is there something that you can do to help MLS to commit to a little bit more flexibility with this program?
With any of these programs, we obviously have to have objective public servants who are using, well-defined criteria that exist in the law and otherwise to say some of these applications qualify and some, unfortunately, do not. What I can do is ask, and I will do this if you provide us with the particulars, ask the officials to review the application and see if there are some minor modifications that could be made to that application to cause it to qualify. But I will say this in fairness to those very same officials, that of the 200-plus applications that have been submitted, I think the vast majority will end up being approved, and so I think the program by that measure will be a great success. But I'm more than happy to have this particular application reviewed again. It's the kind of thing I can ask for without presuming on what the results of that re-examination would be.
I guess one of the other issues is that there is an engineering consulting firm that's working with this and providing their advice on, so there's really not much that they can do regardless of these parameters. I'm just wondering if it's just worthwhile taking a second look to see if it is just too inflexible for some areas of the city.
Obviously, our principal concern, notwithstanding that we really want to help these bars and restaurants to have additional space to produce revenue when they've been struggling and continue to struggle so much, and also provide additional opportunities for the public to enjoy what is a all too short patio season that people enjoy so much. But obviously, our paramount concerns have to always be with public health and public safety. And so sometimes requirements that are put in place in that regard, including a lot of the stuff that's gone on during the pandemic, seem unfair or they seem, punitive. They're not meant to be. But I have said that I'm willing to have these people, including the engineering people, take a second look at this and see if there's a way we can tinker with it or tweak it to make it work, because our objective has been throughout to have this done quickly and have as many people qualify as possible so they can make that extra revenue, hang on to their businesses, and provide enjoyment for all of us for many years to come.
Okay, thank you. Next, we go to Mark McAllister from City News. Mark, go ahead, please.
Mayor Tory, let me follow up on Matt's questioning. You said staff are working closely with the BIAs at wartime speed on this program. We've also spoken with a number of businesses, not yet open, frustrated with the process and the timing of it all, saying it still needs to go through approval at City Council. These applications need to be assessed. Those engineering firms or city staff still need to come for visits before installation. Realistically, how much longer will it take before the city says it's okay for these businesses to open these patios?
Well, can we be very clear on something right at the outset, which is that the date we always said, the first date on which we said any of these could be open was July the 1st. So in that sense, we haven't even reached the date yet where any of these extended patios could be open. And I think if you take an idea that had its conception, I believe, in the month of maybe late May, and that we will take hundreds of applications, we've swept aside some of the regulatory provisions that normally apply. We're making those inspections happen of designs that have to be done carefully in the interest of public safety and public health, and we will have many of those new patios open on July 1st and many of them shortly thereafter. I think we are moving at wartime speed, and I will certainly talk to the officials. I ask them about this virtually every day. I'll ask them again to make sure that we are using every resource possible to get those done. But recognize the fact there will be some that don't get approved. Not every application that's put in can be approved, and there are some that will take longer than others given some of the complicated design features that are, again, in the interest of public health and public safety. But I will make sure we speed this up. But the earliest date any of these was ever allowed to be open, because it hadn't been approved by City Council, among other reasons, was July the 1st.
That's all. Thank you.
No follow-up, Mark?
Fine, thank you.
Okay, thank you. We'll go next to Dave Ryder from the Toronto Star. Go ahead, Dave.
Hi, first question for Mayor Tory, and that's Dr. Davila mentioned the program she's going to be recommending at Health Board next week that I guess is looking at something like they're doing in New York, where it's providing people who are not homeless but who get COVID and live in a crowded circumstance or a small unit where it's hard to socially isolate. Given Toronto's financial mess, Is that something you support? Is it something we could do without the other two governments being involved?
I'm not sure if we could do it alone, but it's something that I do support. And we've had an indication from the federal government a short while ago that they would be perhaps willing to proactively step forward and help us with this. And I think it was partially based on that assurance that we are moving forward, knowing that if we approach them, that we will likely get a positive response. I just think it makes so much sense for people who may live, say, in a small apartment with 5 other family members who go out to work every day, and through no fault of their own, they come home with a positive case of COVID-19, but then really effectively can't isolate in the way that they should. It's almost impossible in a small place like that. And these are the people I think that we owe it to try and help them if we can. And so I'm optimistic that we will get some support from at least the Government of Canada, and that this is something that is the right thing to do, and that if they do come through with support, we'll be able to do it for sure.
All right. And my follow-up, I think, is also for you, Mayor, and that's city staff tell me that as of 4 p.m. today, about just a little less than 6,000 people have registered for CafeTO out of 13,722 spaces. I'm just wondering, I'm guessing some people are just, either haven't done it yet, or maybe they're worried about sending their kids into a kind of a congregate setting. Do you think the program will need to be adjusted if there just isn't enough people to match the number of staff and places you've set up for?
Well, again, I've been speaking to staff over the course of the day and watching to make sure the registrations happened that people tried to carry out, and they did successfully. But at the same time, we were discussing the fact that there are probably some people who are holding back because they're a little nervous about their kids going to school in September, going to childcare, or going to a summer camp for that matter, because we know so little about this virus and its behavior. We have another day of registration to go in other parts of the city, Toronto, East York, West Toronto, York, and North York tomorrow, and we will see what the registration is. But the camps are going to move ahead. We will make whatever adjustments we have to make, and perhaps we will look at some other, kind of registration period to allow for it, to make sure that as many of the families as possible who want to do this have the opportunity to do so. But I understand people's anxiety about a lot of things to do with this virus because we know so little about it.
Okay, thank you. Final question is to Jeff Gray from the Globe and Mail. Jeff, go ahead, please.
Hi, thanks, Brad. Just to follow up to maybe to Dr. Davila or the mayor on the issue of these new proposed isolation centers, do we have a sense of the cost that we're looking at, the number of hotel rooms? Could you elaborate a bit on what the magnitude of this thing would be?
So, Jeff, we're still in the exploratory stage of this, and we know that we can look to other jurisdictions. We've heard that New York has had this and has done this successfully, as has Chicago. We don't have exact figures yet, but certainly we can see that there would be benefit, and my sense is that it would be well worth the investment on our part, and hopefully on the part of our provincial and federal counterparts to move forward with this type of system.
And may I just add to that, that if you look at what we already have in place, thanks to the hard work of our staff and the cooperation of the other governments, we have hotel arrangements in place at a very favorable rate. We have health care support personnel available to us. We have a reduced case count of new people who are being identified as having this virus, so we're down to much lower numbers, and we have a defined period in which they would be isolated, which is normally 14 days. I'm not the medical officer of health, but that's the normal period. So you can look at this, depending on how things go, as a reasonably manageable proposition, especially, of course, if we get support from the other governments, which have proactively indicated to us some possible interest in doing this. And so I think it is one of those things where a lot of the work has been done, some of the arrangements have been made, and it would be something we could, in a fairly straightforward manner, move forward with, and it doesn't have to be, incredibly expensive relative to having these people healthy and stopping the spread of this virus, including to their own family members.
Thanks. And just to follow up, maybe to the mayor, the premier today said that he expects to deliver a substantial amount of money to cities. He said up to the province's capacity. Do you have any idea how much money he's talking about, and have you got a check yet?
I have no check as yet. I did offer earlier today, now that you can get a tattoo, to either have Justin or Doug tattooed across my forehead as a means of promotion of those individuals if one of them was the first to come forward with a substantial amount of money to help cities, not just Toronto, but all the cities and towns across Canada. I do know Premier Ford has been playing a significant leadership role with his provincial colleagues and with the Government of Canada, and I know that the Government of Canada is a willing participant. And they are now, I think, trying to come to grips with what the respective contributions of those governments would be. And I hear the words you speak, which is that the Premier said there will be a substantial amount of money coming from the Government of Ontario, and I'm heartened to hear that. And we might have to take a look at what substantial means, but I know what the size of our problem is. Our problem alone, just in Toronto, it's $1.5 billion. So, you know, I think it's moving forward, albeit more slowly than I would like, but this is in the interest of preserving services for people and making sure we don't have to impose what would be unmanageable, ridiculous tax increases that people just can't afford right now. And I think on that basis, that's why Mr. Ford has been helping so much, and I'm sure they'll come to an agreement very soon.
Okay, that concludes today's briefing. Thanks for joining us, everybody.